Oh, hey there, this is Dr. Evan Osar, author of The psoas Solution. Hope you're having a great start to your holiday weekend. Happy Saturday. Haven't done a Facebook Live here in a long time on a Saturday, so welcome to this edition of Integrative Movement Insider. Today's Facebook Live, we're discussing low back pain. And if you work with the general population, which you do, which you're part of our community, so thank you for being part of our community. Thanks for all you do for your community and allowing us to share this information so you can better serve your community. If you work with clients, you're working with clients that will present with low back pain. In fact, low back pain is ubiquitous across our society. There's so many people with low back pain. There's lots of resources, money, time, energy spent on low back pain. And as I mentioned, no lacking of resources, even though this book is not about low back pain. Obviously, many people blame the psoas for their low back issues. So today on this edition of Facebook Live, Integrative Movement Insider, we're discussing low back pain and the psoas's role in low back discomfort. And it's one of those things, there's never one solution to low back pain. So when your clients come to you and say, hey, you know what, my physical therapist, my chiropractor, my massage therapist said it's my psoas causing my issue, unlikely that's the cause. In fact, people look to this book, the psoas Solution, and say, oh, Dr. Osar, it must be my psoas because you wrote a book about it. I wrote a book about the psoas just to inform people about the psoas. So we'll talk about that here in a moment. And then also to dispel some of the myths around the psoas as being the cause of someone's low back pain. First of all, there's never one, usually I should say, there's never one single cause of people's low back pain. When we think about low back pain, there's three main categories of low back pain. I just want to describe them to you briefly here, just so you have the education, so you can have a conversation with other people who try to say, oh, it's all in people's heads. There's no research that proves that any of this mechanical stuff works. Well, there's three categories of low back pain. First is nociceptive, and that's just your traditional mechanical sources of low back pain. So it could be mechanical facet joint, it could be a disc problem, it could be, tight muscle compromising, the joint on one side versus the other. So it's the traditional mechanical causes of musculoskeletal type of issues. So that's one type. Next type is neurogenic. So neurogenic, as the name suggests, it's nervous system based or nerve related. So that's a disc bulge that may be hitting a nerve, and where the client may say, hey, I've numbness tingling down my foot. They may have some foot drop. They may have other muscular, motor, and or neurological sensation type changes. Just my hand feels weird if we're talking the upper extremity. My foot feels weird. Maybe I'm stumbling on that foot a little bit. So that's more the neurogenic. So we have nociceptive. That's your traditional mechanical, traditional low back sort of, physical mechanical type causes. We have neurogenic, that's more nerve related. Now the third type is nociplastic. Plastic refers to the nervous system and how the nervous system changes and alters itself over time anytime you've exposed any continual stimulus to the nervous system. So for many of your clients, they will have these nociplastic type changes or the changes at the nervous system level because of chronic low back discomfort. So if your client is coming to you and they've had low back pain for any significant amount of time, which many of your clients have, then they're at the point where they're having nociplastic. They're changing their nervous system where now their sensitivity to the pain is heightened most likely, and the things that set them off have been lowered, meaning that they can do specific activities that normally shouldn't bother them, but then actually bother them because now their nervous system is starting to change and the pain signals are starting to change, and how the nervous system is interpreting those movements, so to speak, that starts to impact how they interpret pain in their body. Now, what do you do about the situation? How do you know? Well, again, if your client has chronic pain, they've had low back pain for a long time, which many of your clients have, many of my patients that come in to see me have, well, then they're already in the nociplastic category. Anytime you have chronic pain, and chronic pain is we'll just make it simple. If they've had it for over 8 to 12 weeks, they're in the chronic pain category. So now we're talking about, we have to do some things around this chronic pain, and making exercise or making movement make them not so scared of these issues. Now, the other, when we think about nociceptive, so just your mechanical low back pain, there's a lot of people that will come in that have had surgery, so disectomies. I just had a client that had laminectomies, 2 laminectomies. She's still having some issues. So we've had these clients who have low back pain and had surgery, whether it's warranted or not, that's a whole nother conversation. But they've been told by their surgeons or their doctors or other pain specialists that, oh, it's all in your head, just go do your physical activities. And I've talked to lots of people that have had surgery over my 24 years. Many, many people. I've talked to lots of surgeons. I've studied some of the pain research that's out there. People have real issues after surgery. It's not just all in their head. Now, some people, they have those nociplastic changes. But there are mechanical changes that happen after surgery. So that's why it's so hard, as we're having this discussion, that's why it's so hard or challenging to address chronic low back pain, because there's so many factors. Weight is likely not one of the issues. So if your client's like, I just need to lose some pounds and I'll have less low back pain. No. I mean, losing weight, good. And it will help your overall physiology and your body and your mindset. However, it's not related to low back pain. There's just as many people that are of optimal weight that have low back pain as overweight. So that's not really an issue. So let's spend the rest of our time now talking about the psoas a little bit, and then how we can more optimally use the psoas in our core exercises so that at least we're addressing the mechanical causes. Because even if your client has, it's plastic changes, it's in their nervous system, they've changed these effects, well then, you still got to train them and then train them safely and then introduce them to exercises, graded exercise, to show them that the pain that they're experiencing may not be related specifically to the activities that they're doing. Okay, so the psoas, as you may be aware of, comes from the front side of the vertebrae, T11, T12, L1, 2, 3, and 4. It fascially blends into the diaphragm, okay? So we're lumping the psoas major and minor together because even if 40% of the population does not have a psoas minor, but those people that don't have a psoas minor, physically have a psoas minor, there's fascial attachments from the psoas major up to T11, T12. So essentially we all have a psoas minor, so I'm just lumping the psoas together. Now the psoas major, the psoas, as it attaches off the spine, fascially blends into the transversus abdominis. It fascially blends into the diaphragm. So it's attaching to the diaphragm up here in the backside of the spine, then it runs down the front side of the spine, as I mentioned, and then it crosses the pelvis and inserts into the lesser trochanter. So basically, deep inside your groin here is your psoas attachment. However, the psoas minor branch, or there's also fascial attachments from the psoas that go down to the front side of your pelvis and also into the pelvic floor as well. So here we have a muscle that's deep. It's the deepest muscle. And you can palpate, I'm not saying you can if it's not within your scope of practice, but people that are trained in manual therapy, I can palpate people's psoas if they're thin enough and they're not so sensitive that they're guarding. Yeah, we can palpate the psoas, especially on somebody that's relatively thin. It's easy to palpate the psoas and know that I'm on the psoas. So people that say you can't palpate the psoas, yeah, you can. It's a deep muscle. It's the deepest muscle. It sits underneath the organs. So the kidneys actually sit on top of the psoas. So when we think about this muscle that's deep compared to the superficial hip flexors like your rectus femoris, tensor fasciae lata that cross the hip joint, the pelvis, and the hip joint and go down to the knee or cross the knee, there's a very different function of these deep muscles. These deeper muscles, like the psoas in particular, their job is, number one, their primary function is stabilization. Their role is to stabilize the trunk, spine, pelvis, and hip complex so that when we're standing and when we're walking, that the spine stays relatively stable. Not stable meaning it doesn't move, but just controlled. These deeper muscles, the characteristic of these deeper muscles is they generally contract first before exercise, or I should say before movement. Then the superficial muscles, like your superficial hip flexors, then their job is to do the massive motion, or if you're kicking a ball, their job is to kick the ball, right? To actually move the leg and decelerate the leg. The deeper muscles, they're responsible in that movement, but mostly just to maintain the alignment and control of the trunk, spine, pelvis, and hip complex. The psoas will also pull the hip into the socket. So now let's talk about exercise. Now, how are we going to think about psoas exercise? So people will say, Dr. Osar, I read your book. So how do I train the psoas? You don't really talk about how to train the psoas. You just say it works. Well, one of the things that we train our clients to do is first learn how to align, so stacking the rib cage over top the pelvis. The first thing you want to do is teach your clients where their best neutral is. It's not best for every single person. Some clients' neutral may be a little bit more posterior tilted. Some people will be a little bit more anterior tilted. Somewhere they should be, or somehow, or they should be all closely aligned where the rib cage is relatively aligned over the pelvis. So whether they're a bit more posterior, like some of your older clients will be a bit more posterior, some of your younger clients should be, I should say most of your younger clients should be a bit more anterior. That's where neutral tends to be. We're not trying to force our clients into any specific position. We're just trying to get the rib cage relatively well aligned over top the pelvis so that the diaphragm, which again is attaching to the psoas, the pelvic floor also fascially attaching to the psoas, so that the diaphragm and pelvic floor are aligned so that we can control intra-abdominal and intrathoracic pressure. So the psoas functions as, or this is what I say in the book, just because I haven't seen any research on this, I believe that the psoas is functioning to stabilize the spine as the diaphragm is pulling upon the spine, as the pelvic floor is moving along or inside the pelvis. So the pelvic floor and diaphragm, as they're moving, regulating pressure, and the spine and ribcage are moving, the psoas is maintaining stability. So one of the things we want to do during our training is train the alignment and control of the thorax over top the pelvis. Hello, my friend, Jackie Bachmeyer, my good friend from Houston, Texas. Oh, Robert Linkle. Hey, what's up, buddy? How are you? Good to see you, man. So what we want to do is train the rib cage to align over top the pelvis. So just say we're doing a plank. So I'll just do the plank on the edge of a table here. We want to teach our clients how to get that rib cage and pelvis aligned so that when they line up in their plank position, we have a relative alignment of the rib cage and pelvis. If you're doing a squat, align that rib cage and pelvis and teach clients how to do a squat or how to do a hip hinge or a swing pattern, maintaining their most neutral alignment. The psoas, again, remember, is the primary function is to maintain that alignment of the spine, to control it during more dynamic movements. Initially, it's about training the rib cage over top the pelvis to maintain this cylinder, because again, it should be like a cylinder, and we should be able to maintain this position regardless of what we're doing with the lower extremity, what we're doing with the upper extremity. So if you're doing a rotation pattern, same idea. You're still maintaining alignment of the ribcage over top the pelvis, and now you're teaching the client how to rotate their cylinder over top that lower extremity, or rotating their upper extremity around that long axis of their spine. So lots of ideas of, or I should say, one general concept is to stack the cylinder, then teach three-dimensional breathing, which I did not mention, is to teach three-dimensional breathing so that the client learns how to control the rib cage over top of the pelvis, and then take them through your functional movement patterns. But don't go so crazy, because one of the things I see with clients with chronic low back pain is they're always trying to do, like, I do planks and I'm doing these crazy things like this and I'm reaching here and reaching here. I'm like, that's cool. That's awesome that you can do that, but it's unlikely you're doing it well. And most times they're not doing it well. So I think one of the things that we struggle with as health and fitness professionals is we get a little ADHD with our exercise programs, and we focus more on we get a little bored teaching some of these exercises, fundamental exercises and fundamental movement patterns, that we want to get things a bit crazier. And we want to make things fun for our clients. There's lots of ways to make exercise fun and give them challenges that are fun as well. However, the bulk of our training program should be based around teaching our client how to align and control, teach them how to progress appropriately. And that's really, when we think about our programming, that's the essence of good programming. Effective programming is focus on the fundamentals. If you look at the people that program the best, a couple of them are online. My good buddy Robert is probably the best person I know as far as programming. They're simple programs. There's not a lot of complication to them per se. There's a lot of factors that go into programming, but programming is quite simple. It's usually the less optimal your programming is, the more dynamic and crazy the exercises tend to be. The more you understand about programming and progressions, the more tight your program starts to look, the more effective the program tends to be. And there's not one program that's going to work for everyone. And that's why you need modifications of exercises and levels of exercises for certain clients that have low back pain. So in recap, the psoas is primarily a stabilizer of the trunk, spine, pelvis, and hip complex. Focus first on teaching your clients how to align and control that thoracolpelvic cylinder, rib cage over top the pelvis. Primary patterns for training the psoas, training the core, training clients with low back pain is teach them just how to control that cylinder. Just teach them to really own that position, own that alignment. Yes, you'll need to teach your clients how to move out of that position as well. Absolutely. But teach your clients how to own that position first. Make sure they have really good control of that. Check range of motion before and after their exercises to see if they're actually maintaining. Range of motion should not change during their exercise patterns. And then program appropriately. Just have fun with your programs, but don't go so crazy that that your client can't control it, and that's what's ultimately moving them into issues. Like my client, I had a client that came to me with chronic low back pain, and she's like, "Yeah, I can do a 7-minute plank." I'm like, "That's cool. That's cool to impress your friends with, but obviously it's not helping you." So she wasn't aligned very well. She was tucked under. Pelvis was like when she walked, like her pelvis would be way in front of her body. Again, those things aren't impressive that you can do a 7-minute plank, unless you're trying to win a plank contest. Just get good at teaching clients how to align and control. Teach them how to move appropriately, just movement efficiency, all the things that you're already doing. So most of you that are watching, you already know what I'm talking about. So, and then you can really help a lot of clients. Just understand some basics. Understand that if your client has chronic low back pain, they've had it for a long time, they're going to have those nociplastic, those nervous system changes. Just realize that not everything you do, and maybe they have more pain afterwards, the next day, it's not always related to what you did with them. It may just be that there's some fear, there's some animosity around certain movements. Just help educate clients around this issue. Nobody has all the answers. Nobody has the exercise or the routine, the movement that's going to help everybody. And understanding that, you're going to help a lot of clients. So thank you again for watching. Thanks for being part of our community. If you're looking for more information, you can check out the psoas solution. It's on Amazon for $16 or something like that. A lot of great information about the psoas if you like to learn anatomy. If you're looking for an online resource, we did 2 Anatomy Geeks spinal conditions. It's basically 3 series that we did, one on the head and neck, one on the trunk and spine, one on spinal conditions, where we go through the spine. I teach you about the anatomy of the spine, or I should say I and my second Anatomy Geek, Jill, teach you about the spine. We talk about anatomy, how it relates to certain spinal conditions, and more importantly, we show you how to use this information to help your clients. So that way you can take this information and apply it. It's just not like, here's a psoas, and here's what it does. And okay, that's great. Have a nice life, right? It's like, no, here's your anatomy. Here's how to apply it to your assessments. Here's how to use it in your exercises. And what's cool about this information is you can go and apply it right away. I remember hearing or reading a comment from Damien. He's like, what's so cool about this? I learned this technique. I went home later that day, or I went to my clients later that day, used this information, and they felt better. They had better range of motion. They felt better. This stuff works. So that's what we really love about this community. It's a great community of like-minded individuals just like you. It's resources, a resource that you can put to use right away, and it will really add to what you're already doing with great success. So check out 2 Anatomy Geeks. The link is next to this video, Facebook Live. If you have any questions about low back pain, besides what's wrong with my client that has low back pain, I don't know. You got to do your history, you got to do your assessment. But if you have any more general questions about exercises, low back pain, things you've heard, put them next to this video. I will get back to them once I figure out how to find it. Still a little technically challenged with Facebook, even though I've been on here for forever. So hope you have a great Saturday. Hope this helped you. Keep doing what you're doing. You're doing great things for your clients. And in this crazy world of lots of things that are out of our control, this is the one thing you can really do to help your clients gain control. Help them learn about their body. Help them learn about the power of exercise. I just read a research study yesterday from 2021, basically saying that exercise is the answer for most medical issues. I mean, we know that. You and I know that. We just have to be better at standing our ground, educating and empowering our clients, and really helping them take ownership of their healthcare and stop giving away their right to choose, stop giving away their power to other entities, and take on their responsibility for their own body. So again, thank you for all you do. If you want to join us, to Anatomy Geeks, great series, great information that you can apply to your clients right away. This is Dr. Evan Osar. Thanks again for all you do. We'll see you next time at Facebook Live. Happy holidays. Have a great weekend. Okay, let's look at it.